My name is John Garvey and I'm a general surgeon and I have a specific interest in groin and hernia injuries. Well, a general surgeon operates on body parts not covered by other recognised specialities such as heart, eyes, ear, nose and throat, brain, obstetrics, etc. But we mainly deal with injuries that occur on the trunk and abdomen. I specialise in injuries of the groin, that is that part of the body where the leg meets the trunk. And these are things like hernias and groin disruption injuries and touches upon a lot of specialties including digestive tract, orthopaedics, neurosurgery. In my role as a general surgeon, my work involves reconstruction of groins in injured sports people and also in injured workers. Well, I first became interested in this specialty when I started practice in 1990 when I was working in the inner western suburbs of Sydney at Campsie, and I received referrals from the Canterbury Bankstown Bulldog Rugby League Football Club. That was in the next suburb of Belmore where I was working, and in the late 80s and early 90s they had a run of undiagnosed groin injuries that needed to be sorted out. So I received my first referral in August 1990 and I've been working on that injury ever since. Not exclusively that injury, but it's been a significant part of my practice. I then started a specific groin injury clinic at South Sydney Sports Medicine where I was working alongside orthopaedic specialists and sports physicians. And then I moved to Macquarie Street in Sydney in 2005. I enjoy this line of work because I'm the only surgeon dedicated to this specific area of injury, and the research that I'm undertaking and the clinical information gained allows me to speak about my work at various meetings both internationally and locally and educate my colleagues in the type of treatment that's available. Unlike other injuries, sports people have to overcome their struggles in public view because they are so visible every day, and failures and successes in this domain are there for everyone to celebrate or commiserate. Operating on sports people is also a social responsibility to get players back on the field of play, because not only do the players depend on it for their lifestyle, but athletes need to be fully fit to participate in their community to help with the psychological well-being, as described by Craig Foster in his interview with Barry Cassidy in early May this year. I see mostly people who have groin and hernia injuries and digestive tract injuries, and I provide treatment and consultations and second opinion. The personal injury assessment came as a byproduct of my work on groin injuries because I developed an experience in the treatment of groin injuries. I don't just treat groin injuries, I assess all types of general surgical problems, mainly digestive tract, but also other areas including reproductive system, urinary system, skin, and other matters of general surgical interest. Most of my patients come from the sporting arena, and I like working with sports people because they're very fit and healthy and highly motivated to get back on the field of play in the minimal amount of time, follow my instructions explicitly, and usually have a good outcome. And I've published 94% success rate for the groin reconstruction operation. The other injuries that I deal with are in injured workers. So my work is split about 50-50 with injured workers and sports people. The injured workers get the same injury, but by a different mechanism. But it's essentially the same injury: sports, hernia, groin disruption injury. It's all the same type of injury in the groin. A groin disruption injury is a combination of injuries that takes place around the groin. So it usually consists of a hernia, conjoint tendon tear, an adductor tendon tear, osteitis pubis, and peripheral nerve irritation. So all of those things make up what is known as groin disruption injury. Most people get at least 3 of those components to make up qualification of the symptoms for the injury, but some people have 2 components and some people have all the components. So it's hernia, conjoint tendon, adductor tendon, osteitis pubis, and peripheral nerve irritation. When I'm working with claimants, my objective is to give an independent assessment, which is factual and up-to-date and research-driven and prompt. The new technology of voice recognition has enabled me to produce reports that are expeditious and in a very short time, but I'm only interested in accuracy and compliance with the relevant guidelines. When an injured person leaves my consultation room, I want them to be satisfied that they have a patient and understanding hearing, thorough examination, a personal review of all their x-rays and scans, and been given the opportunity to say everything they feel that they need to say to the specialist before the report is sent to the referrer. Utilising my personal experiences as a treating specialist surgeon, and I'm still in full-time surgical practice, I like to feel that I have provided an honest assessment that's free of bias and has a tacit encouragement to the claimant to get back to the normal working life and be a productive member of the community as quickly as possible.